The debate over health care reform continued today in northeast Wisconsin, but lawmakers in Washington are still hammering out the specifics of what the reform proposal will actually be. Congressman Steve Kagen returned to the 8th District today to meet with constituents.
Now, many people are still asking questions about what is being considered, while some have already made up their minds on the issue. Fox 11's Lou Hillman brings us multiple views.
About 200 people showed up at the Brown County Library to hear firsthand where lawmakers are at in terms of coming up with a health care reform proposal. The forum was hosted by the League of Women Voters.
We were pleased, and we do hope that people went away feeling that they got some answers.
We put our minds together.
Democratic Congressman Steve Kagen led the discussion. Kagen still believes a government health care option is necessary, even though other Democratic lawmakers have backed off of the idea.
Well, I think it's one of the ways that you can create a level playing field and a competitive marketplace.
Cheryl Dietrich isn't 100% convinced, but she says it's worth a shot.
I just think the time is now. We've talked about it too long, and the prices have gone up so much.
Mike Keene, however, believes government intervention will lead to a lower quality of care.
Congress is not willing to sign up for this public option that they're willing to force onto other people. That tells me that Congress doesn't believe in their own product that they're trying to push off onto other people, and that to me is wrong.
A handful of Democrats are now in favor of a plan that promotes insurance co-ops. Some argue the government will still play a role in the process.
The biggest concern I guess I have is that people are trying to look to the government for answers in a situation that is more personal.
Kagen says reform is needed with or without a government insurance option.
I want that price to be openly disclosed, where you get to pay the lowest price available for that prescription drug, for that MRI, for that doctor visit, and certainly at the hospital.
Both the House and Senate each have to pass their own proposal first. Then a conference committee will start hammering out the differences between the two. In Green Bay, Lou Hillman, Fox 11 News.
Both the full House and Senate are expected to vote on their proposals later this month. Republican Congressman Tom Petri of the 6th District is against a government insurance option. Petri says there isn't enough money to pay for what is being promised.